How could stress have that much of an impact? Well, let's start from the beginning, the normal stress response. And if you look here, these are a list of stressors, and I will list those more clearly in a few slides. But these stressors like toxic exposure and light cycle disruption, food intolerances, temperature extremes, and trauma. These are physical or environmental stressors that we may live with every day. There's also physiologic stressors like glucose dysregulation, chronic infections, pain, lack of sleep, even dietary imbalances. If you're not eating enough of the right nutrients, excessive exercise can be a stress, chronic inflammation, serotonin and GABA imbalances. These are neurotransmitters. Emotional strain, anxiety, depression. This is what we usually think of as stressors. But all of those will stimulate the sympathetic nervous system to make epinephrine and norepinephrine. And it also will stimulate the hypothalamus pituitary to make ACTH. Now, both of these affect the hypothalamus pituitary, and ACTH will signal to the adrenal gland to make cortisol. Cortisol's primary goal is to mobilize glucose so that you have the energy to deal with the stress. And then there's also DHEA, which is anabolic, while cortisol is catabolic. And as long as these are in balance, then everything is fine. But when this gets out of balance and the stress is causing more cortisol production and not enough DHEA, that's when problems arise. And we will talk about that as we go further in the lecture. Now, again, these are a list of the types of stressors. Food intolerances, we have heard about gluten sensitivities, but you can have food intolerances to all types of foods. And if you don't know that, every time you eat that food, you are causing a stress response. We can look over here at glucose dysregulation. We know that when a person's blood sugar is low, they get very jittery. That's the sympathetic nervous system alerting you that your blood sugar is too low. Chronic infections, whether you know about the infection or not, it is causing a 24/7 stress response. Lack of sleep, dietary imbalances, excessive exercise. A lot of people will exercise to try and relieve stress, but if you overdo it, it can become a stressor. Chronic inflammation and neurotransmitter imbalances. Well, there's a great book called entitled Why Zebras Don't Get Ulcers. And the reason why zebras don't get ulcers is because they understand that the stress response should be a short-lived response. The stress response is called fight or flight because that's what it is designed to do, and zebras understand that. And what happens, their stress response is activated when they are threatened by a predator or threatened by another zebra that is trying to move in on their family, and they have to figure out, are they going to fight that predator off or that adversary off, or are they going to run? And the stress response does this very well. It increases the blood pressure, heart rate, and heart contractions so that the blood flow to the active muscles are increased, therefore delivering more glucose and oxygen to those muscles. Now, because you have a finite amount of blood, if more blood is going one place, then less blood has to go somewhere else. So what happens is there's less blood flow to areas not needed for rapid activity, such as kidneys and intestines. The pupils are dilated, so the zebra can have better peripheral vision, so it can see where to run or where the enemy may be coming from. It has zebra will have dilated bronchial tubes, so it can have more CO2, O2 exchange. It has increased muscular strength because there's more glucose and oxygen going to those muscles. You release saved glucose from the liver while you saving glucose in the form of glycogen if you are in a life or death situation. And so therefore more glucose is released. You have increased mental activity initially, and you have increased metabolic rate. That is all in an effort to allow the zebra to run faster, to be able to fight harder because now it has more strength in those active muscles. It gives it a quick energy source by releasing all the glucose into the bloodstream. The zebra can become lightweight because the way to become lightweight quickly is to empty your large intestines. So that's what the zebra is stimulated to do. It allows the zebra to think quickly because you have all this glucose going to the brain, and you block pain in a stress response. Now, that's fine for humans as long as it's an acute stress. Boss yells at you, threatens you that you have to get this job done, in 24 hours. You have a biological response. What happens? You get this increased heart rate, increased heart contractions, you get more blood flow to the brain or whatever you need to do. You deal with the threat, and then you deliver the project and you relax. So that's great. But as you saw in the list of stressors, some of those stressors that you may be unaware of are 24/7. Like a food intolerance or some chronic inflammation. So under chronic stress, you have a threat, you have a biological response, the threat continues, you continue to have that biological response, you have the continuing threat, and then eventually it wears down the system that is responding. And now you have symptoms, and if you don't relieve that stress, it will eventually lead to an illness. What you need if you are a zebra. If you are a zebra in a fight or a flight situation, at that particular time, you are not concerned about reproduction. Therefore, hormone disruption is not a big deal for 20 or 30 minutes. Not balancing your estrogen and progesterone is not such a big deal. So reproduction is not a main concern. You are also not worried about energy storage. So insulin resistance is actually a good thing. You don't want the glucose to be stored away as fat or whatever. You want it to be in the bloodstream. And the muscles do not need insulin in order to bring glucose into the cell. So this works great that you have a kind of restricted insulin resistance. When you are in a fight or flight situation, the adrenaline wants to control all energy consumption. Therefore, it disrupts the thyroid so that you're not producing energy in all systems. You tamper down the thyroid system so that adrenaline can take full control. You have decreased GI absorption because at that particular time, you can't waste energy trying to digest food. We all know that that takes a lot of energy. That's why we get sleepy after we eat. So you get decreased GI absorption in a fight or flight situation. You do not want water wasting. You want increased intravascular volume so that if you are in a fight and get injured, it takes longer for you to bleed to death. So we actually want water retention. And also because there's less blood flow going to the kidney actually sees that as a intravascular volume decrease. So it begins to stimulate water retention because it sees less blood flow going to the kidney. At that particular time in a fight or flight situation, you are not concerned about your immune system protecting you against a long-term disease like a cancer. So that part of the immune system gets suppressed, and the part of the immune system that fights off an immediate infection is increased. And the last thing you'd want to do if you're in a fight or flight situation is to fall asleep. And also, if you had just run away from a predator or you had just fought off an adversary, you would not necessarily want to go into a deep sleep a few hours and maybe even days afterwards. And so therefore sleep is kind of suppressed so that you can kind of sleep with one eye open. Again, that works fine as long as you are a zebra, because you have to think that that zebra is either going to win the fight or it's going to win the race, or it's going to lose the fight or lose the race. If it wins the fight or wins the race, it's going to relax. And it's going to say, wow, I got rid of that predator and I'll relax until something else threatens me. If the zebra loses the fight or loses the race, then the zebra is going to be dead, and dead zebras don't have a stress response. So either way, it's going to be a short-lived response. Our problems are that our problem is that the stressors don't necessarily last for 15 or 20 minutes. They last for 15, 20, 30 years. It can last a lifetime. We are always exposed to pollution. We all have deadlines that we must meet, whether they're personal or professional. We have to deal with temperature extremes that our body has to adjust to. We all are overloaded in this society. We have family relationships. We have ex-husbands and stepchildren and sick parents, dying parents, and all of these family relationships, they last a lifetime. Everyone has some concern about their finances. Everyone has to deal with death of loved ones. And then we're dealing with our own illnesses and our illnesses in our immediate family. So these are all stressors that do not last for 15 to 20 minutes. They last sometimes for a lifetime. And if you're dealing with these stressors, these are not stressors that require you to run fast or to fight hard or to have quick energy or to be lightweight or think quickly or block pain. None of these are necessary with the type of stressors that we face, but the stress response only knows how to respond in one way: increased blood pressure, increased heart rate, increased heart contractions. And we know we feel like this when we're under any type of stress. It's going to decrease blood flow to areas not needed for rapid activity, like the kidneys and intestines. All of these things happen, even though they are not what we need in the situation that we may be dealing with. And things you do need if you are human, if you're dealing with pollution, if you're dealing with family problems, you are still interested in reproduction if you are in that reproductive age. But still, stress will cause hormone disruption. You are not necessarily wanting to have insulin resistance during this time. You want glucose to go into all the cells. You want your thyroid to work. You still want to be able to digest food. You still would like for your kidneys to work. You'd still like to be able to sleep. And you would still like for your immune system to work. But it doesn't matter. Your stress response only knows one way to respond. And when stress is present, everything is going to go to cortisol. So if you looked at my hormone replacement made easy, this is important, and you're not going to be able to balance hormones if you don't understand this. And stress is so prevalent, we all need to figure in stress as being a part of hormone replacement therapy because it can be so disruptive. Again, stress, it affects all hormones. It suppresses GnRH, which is going to suppress LH and FSH and sex steroids, and it can contribute to a decrease in bone mass and osteoporosis. Also, if you look at the right side over here, stress is going to decrease growth hormone, and we have a lot of people who are on growth hormone or want growth hormone, but most of the time, if you can control this cortisol, then growth hormone will return to normal. As you can see, cortisol can be a part of the metabolic syndrome. So stress rules all. When you are under stress, and that works great for the zebra doesn't care about any of this for those 15 or 20 minutes, and that's understandable. But when it becomes long-term, it can cause physical effects in almost every organ system, as you will see. So early stress symptoms: headaches, stomach problems, eating problems, fatigue, skin rashes, chronic mild illnesses, sexual dysfunction. And we can understand all of that now because we understand how stress affects all those systems. Psychological and behavioral problems: anxiety, irritability, depression, accidents, domestic violence, alcohol and drug use, and even workplace violence. Well, some of the long-term health problems: high blood pressure, heart disease, immune system dysfunction, asthma, spastic colon, diabetes, psychological, behavioral, serious depression, burnout, suicidal behavior, domestic violence. We talked about all this. So physical effects of stress. All of these symptoms can be derived from an abnormal stress response or a prolonged stress response. Headaches, feelings of despair, lack of energy, sadness, nervousness, anger, concentration problems, memory problems, mental health problems. All of these affect the brain and the nerves, and it all comes from stress. You can have skin and acne and other skin problems. This can come from the hormone disruption, the women making too many androgens. Also, the skin problems can come from the fact that the GI system is not working appropriately and is not properly detoxifying you. Most skin problems can originate in the gut, and most gut problems can originate from stress. Muscle aches and tension, especially in the neck and shoulders. We know how we tense up when we are in a stressful situation. And you get increased, reduced bone density. We talked about that with how stress can affect the sex hormones, and then that can lead to osteoporosis. It goes without saying that your heart is going to beat faster. You get a rise in blood pressure because it's trying to get more blood to those active muscles. You get increased risk of high cholesterol. Why is that? Because cortisol is made from cholesterol. So you're going to release or make more cholesterol so you can make more cortisol. Nausea, stomach pain, heart burn, weight gain, all of this is due to the fact that there's less blood flow going to the gut. So now the gut cannot repair itself as well. This can lead to leaky gut and problems like that. Increased risk of diabetes because of the insulin resistance caused by stress. You get diarrhea and constipation and other digestive problems, again, because there's less blood flow going to the gut. The gut needs to absorb nutrients, but also it needs nutrients in order to repair the lining that's constantly being bombarded by different things that we take into our system through eating. The reproductive system, we already talked about how it's disrupted by stress. And then the immune system has a lowered ability to fight or recover from illness. And also a lot of autoimmune diseases are caused by the fact that the immune system is actually stimulated short-term because it's thinking that it's dealing with a short-term invasion. Now we look at those top 10 drugs and we see how all of those may be related to stress. We talked about how stress disrupts thyroid function, why it increases cholesterol, why it disrupts the immune system, why it disrupts the GI system. And all of these have something to do with what we just talked about, insulin resistance, neurotransmitter imbalances. So now these top 10 drugs can all be related back to stress. So if we really understood stress, how to identify it, how to treat it, how to monitor it, maybe if we got control of the stress response, we wouldn't need to put patients on all of these drugs that we really have no diagnosis for. So now we know the root cause, we can look and say, hey, maybe we need to investigate stress and how to manage it and how to measure it and how to treat it, and maybe these drugs won't be as necessary. If we go back to Ms. Jones that we talked about with all of those vague symptoms, I think the primary problem is that we were doing tests to make sure that Ms. Jones wasn't sick, and Ms. Jones was trying to tell us that she was not well. And as physicians, if we're looking at adrenal problems or stress problems, because that's what we associate with stress, the adrenal gland, we are taught the diseases of the adrenal gland, which is Addison's disease when cortisol is very low, and Cushing's syndrome when it is abnormally high. Now, if you did tests to look for adrenal disease, that most people aren't at this level. They're not so low that they have Addison's disease, and it's not so high that they have Cushing's disease. But if you have been operating at somewhere in this optimal level for most of your life, and now the stress has depleted, and initially what you'll see is that stress will cause cortisol will go up, but as the stress continues, the adrenal gland will begin to fail, and then you get this low normal cortisol. And even though you don't have Addison's disease or you don't have Cushing's syndrome, if you are operating here, lower than normal or higher than normal, then it is going to cause symptoms and you're not going to feel well. And so when you say the doctor says I'm not sick, but you don't believe you're well, both of you are right. And that is what's causing all of the discord between physician and patient. And so in functional medicine, and what we're going to talk about is not waiting until a person has a disease, because the person may not ever meet the criteria of Addison's disease or Cushing's syndrome. This has to be 2 standard deviations from the mean. And very few people will meet that criteria. But if you are living your life at 1 standard deviation below or above the mean, you are not going to feel well, and you're not going to feel normal, and you're going to have some or all of those symptoms that we just discussed. So what we're going to talk about next is, how do you measure the function of the stress system, the sympathetic nervous system, and the adrenal system? How do you measure the function? And if someone is functioning at 40 or 50 or 60% of their optimal level, how do you move them closer to that 100%? We may not get to the 100%, but if we can go from 40% to 70% or 80%, that person is going to start to feel normal again. Maybe their immune system starts to work again. Maybe their gut works again. Their thyroid begins to work again. And that's what we're looking for. How can we function at our highest level for the longest amount of time? And that's what we're going to be discussing next.